right. Well, good afternoon. My name is Megan Sanders, and I'm the Training and Evaluation Specialist for Partners Resource Network. And we are really excited that you have jumped on to join us today for this webinar. This is the Anxiety Disorders in Children with Dr. Hallmark, and we'll get him started here in just a minute. Before we do, I want to introduce our Director of Statewide Services. This is Ms. Christina Henning. And she'll be helping us today with technical issues as well as Q&A and all of that good stuff. We are the nonprofit agency that operates a statewide network of parent training and information centers. You know us as Path Project, Penn Project, and Team Project, depending on your part of Texas. And we are federally funded from a grant by Department of Education, Office of Special Education Programs, or OSEP. And we provide training and education, information, referrals, technical assistance, and emotional support for parents of children with disabilities birth to 26 years of age. And so that is who Partners Resource Network is. We have teamed up today with Grace Psychological and Dr. Hallmark to provide this webinar. And so before we get started there, I do want to introduce him. And Dr. Charles Hallmark is a bilingual in English and Spanish licensed psychologist and licensed specialist in school psychology, or LSSP. He received his doctorate in combined counseling/school psychology from the University at Buffalo State University of New York. His research is focused on the measurement of parental responsiveness for parents and children with ADHD and disruptive behavioral disorders. Current areas of expertise include treating children and adolescents with disruptive behavior disorders, autism spectrum disorder, children and adults coping with grief and loss, depression, and anxiety disorders. He also specializes in parent training programs and bilingual school psychology, including diversity and multiculturalism. Dr. Hallmark is currently on staff at Cypress Fairbanks ISD, where he co-implements an evidence-based manualized parent training intervention for families of children with autism spectrum disorder and speech-language delays. He serves as a co-chair on the department's diversity committee, and he's currently providing postdoctoral supervision to provisionally licensed psychologists. At Grace Psychological Services, Dr. Hallmark conducts psychoeducational and psychological evaluations and provides counseling. He utilizes primarily a cognitive behavioral approach and incorporates family systems theory and solution-focused approaches in his therapy with children and adolescents. He also provides family and individual child-focused psychotherapy for children, adolescents, and adults with history of trauma, mood disorders, and autism. And Dr. Hallmark is in network with Aetna and BCBS as a PPO. All right, Dr. Hallmark, you are free to get started, and we will be taking questions at the end. So if you have questions, please make sure you put those in the Q&A box for Dr. Hallmark to answer at the end of this presentation. Thank you.
Thank you, Ms. Sanders, and thank you everyone for taking the time to be with me today. I've been looking forward to presenting some information on this topic about children and adolescents with anxiety disorders. So just to give you an idea of what the agenda will be for today, I'm going to start by talking about some general information regarding statistics for mental health and anxiety. What are basically normal fears by age? When it's appropriate to seek help or when you should have, be concerned, and who do you seek help from, as well as some risk factors to consider, and additional kind of signs and symptoms. I'm also going to discuss just a little bit what a school can do, particularly in partnership with parents, and I'm going to discuss what the literature says in terms of the relationship between anxiety and different kinds of disabilities, such as learning disability, reading disability, and also the relationship between anxiety and autism. And I'll conclude by providing some specific tips of what parents can do if they're concerned regarding their children's anxiety. So in terms of mental health and anxiety, 50% of mental health illness begins before age 14. And about 1 in 5 kids in the United States have a diagnosable mental health or learning disorder. yet only 80% of diagnosable 80% of diagnosable anxiety disorders do not receive treatment. Therefore, it's hugely important that we try to intervene early. And clearly, as you can see by these stats, there are a lot of kids not being served, in terms of needing treatment for their anxiety disorder. So some normal fears by age. So between, as a toddler or, between 0 to 2 years of age, some concerns that are appropriate for kids to have, would be like stranger danger, loud noises, or people in costume. So as children get older, like 3 to 4 year old children, appropriate fears or normal typical fears are, dogs and other animals, the dark, and changes, whether they be changes in routine or changes in the environment. So in school age, so around kindergarten, some concerns that are appropriate for kids to have are like making a teacher mad or what the teacher might think of them, getting sick, being afraid of getting sick or getting hurt, and bad dreams. So as a child gets older, 7+ years, typical concerns that kids might have are sudden tragedies or getting sick or dying. And that makes sense because cognitively, it's around this age that children start to understand that death is not a reversible phenomenon. So these short vignettes, the purpose of these is just to highlight what we want to look at is frequency, duration, and impairment. So frequency, how often things are going on, like how often a child's exhibiting fears, duration, so like is it a couple of weeks or is it months, and impairment, to what extent are a child's fears interfering with his or her ability to get to school, to participate socially with peers, and things like that. So this first vignette, we have an 8-year-old who's afraid of going to school in September. It's a new school and a bigger one. At first there are a few tears at the bus stop, but then generally has a good day. And this lasts for a few weeks. So would that be normal or not? In each of these vignettes, we need a little bit more information, but what we're seeing is fairly typical. Some kids, aren't going to be fearful about attending a new school. Let's take our second one. 11-year-old has a routine at night that involves pillows and blankets needing to be arranged in a certain way, needs good night kisses and hugs. And if that routine is interrupted, it's mildly upsetting. So for this child, she might just have that particular routine, and if it's interrupted, she might get a little upset, but she nonetheless is able to fall asleep. That would be normal. 10-year-old who does not like to talk about getting sick and hates hearing about vomiting. Well, a lot of people, children included, don't like hearing about vomiting. So it would be important to just get additional information. So again, if we're thinking about frequency or impairment, how often is that happening? And is it interfering with daily activities? Like, are they afraid to use the bathroom, or are they constantly, reporting and, seeking reassurance that they're not sick? So when should we seek help? So these are just some general signs or scenarios in which it might be appropriate to consider getting more help. So the first one, a child is frequently complaining about physical illness, and that physical illness, there's no organic basis for it. They've been checked out by a pediatrician or a specialist, and there's really no reason why they should be reporting that they're feeling ill. An interesting thing about kids when they have anxiety, particularly kids who might not have very strong verbal skills, but kids in general as well, is that they tend to somaticize, or they tend to report physical complaints of being sick when they're feeling anxious. Because that vocabulary, that feelings vocabulary saying like, I'm feeling sick, that has yet to develop. So a second scenario, so school began in August and it's now October. The child continues to cry when approaching school every day, and this results in the parent having to physically guide the child inside the school each day. So clearly that's a moderate level of impairment, and that there might be something there that you want to refer to a practitioner. Excessive concerns about being on time for school, concerns about being good at school or at sports, even when those concerns are not expressed by others. So kids who might enjoy sports but are afraid to play on the team, or are afraid to participate in other activities because they're afraid of being embarrassed, and there's no basis for that because they have the skills to do the activity, and they're generally in an accepting environment. So becoming excessively upset about less than perfect performance, perfectionistic tendencies. So kids who might fill out a ditto in a class and then have to erase the whole thing and do it again, even though clearly, it takes up instructional time for that kid, that would be something to be concerned about. Again, the child demands to redo tasks, erasing and recompleting worksheets, even though it's not necessary based on the teacher's evaluation. Speaking in front of parents, but not speaking in front of other relatives or at school, that's kind of a red flag, and that might indicate concerns associated with selective mutism. Unable to complete independent activities away from parents. So like even basic things such as showering in their own bathroom or needing parents to always be in close proximity. Clearly that, that could be indicative of some kind of separation anxiety. And those difficulties mentioned last longer than a month, and any attempts that parents have made to kind of work with or accommodate those fears have not been working. So these are just some general times when you might want to seek help. So who do we seek help from? So one person, if when your child's in school would be a school counselor. School counselors have some really good recommendations of general things they can do at school in terms of accommodations. And they also have some things that they could recommend that a parent pursue at home. So let's say meeting with the school counselor that the child gets very anxious in class or gets, and as a result gets very frustrated, engages in some disruptive behavior. They might recommend some kind of general cool down area, for example, or they might just meet a couple times with the school counselor and rehearse coping strategies like Fivefinger breathing, different kinds of deep breathing, progressive muscle relaxation, or kind of like positive self-talk to help guide them through the school day. So with that kind of intervention, if that doesn't appear to be working, it might be appropriate to conduct what, and the vocabulary might change from school district to school district, but what's typically referred to as a student review. And at a student review, that can include a licensed specialist in school psychology and or speech pathologist. And I say a speech pathologist because, for example, when I was talking about selective mutism, you want to rule out whether or not there's some kind of expressive or receptive language delay, if that is appropriate and the child's younger. So that meeting can happen with an LSSP, a speech pathologist. It can include the counselor, and it can include the child's teachers. It can include an assistant principal or the principal. And some outcomes of that meeting can involve just general strategies that the teacher can implement in the classroom. It might also consider eligibility for a 504 plan due to anxiety. Other outcomes might be a psychological consultation. So the LSSP would then have permission to go and observe in the classroom or collect data from teachers. And then further on, considering an assessment for special education services if the child is not already in special education. Outside of school, what a parent can do is consultation with a licensed psychologist, schedule an intake appointment, a counselor, and or psychiatrist. So these are some risk factors that were found in my perusal of the literature. And so one risk factor for a child developing anxiety is a family adversity, which that makes sense. If a preschooler, for example, is having to deal with a number of different kind of risk factors or different conditions that can be problematic. So what are we defining family adversity as? That might include low educational level of parents, confined living conditions, single parenthood, or conflicts between parents. Preschoolers who met only anxiety disorder criteria were found to come from households with the same level of adversity as those who didn't have a diagnosable disorder. Those with poor parents with poor mental health functioning, so if the parent endorsed anxiety or depression symptoms themselves, that was associated with a poorer outlook for preschoolers. So this is just one particular study, and it's important to underscore that, of course, low educational level or confined living conditions, those don't necessarily cause childhood anxiety. It's just if you have enough of these risk factors, that increases the likelihood a child might develop anxiety. So symptoms. What kind of symptoms might a parent see in a child who is reporting difficulties with anxiety? So the first thing, as I mentioned earlier, somatic complaints are often reported, so such as headaches, stomach aches, And those somatic complaints don't necessarily have a physical basis. Other things to look out for is if the child has been referred to mental health or behavior concerns at school, social concerns. So if you're concerned about your child being able to initiate or sustain social interaction with peers, or if your child generally withdraws or avoids other kids, that might be something to look out for. Academic concerns. So if they're not performing adequately in school, or things like those perfectionistic tendencies I mentioned earlier are cropping up, that's important to consider. Attendance problems. So it's tricky, but sometimes kids who miss a lot of school, it may be a sign of what's called school refusal, and school refusal tends to be associated with anxiety. And to kind of look into that further, you kind of want to conduct a student review, as I mentioned earlier, reach out to your child's school and see what their behavior is like when they do attend school. So children who have difficulty learning in general are at increased risk of mental health problems. And that makes sense because it's really important as kids are growing up to develop a sense of autonomy and self-worth. And if they're getting feedback from the environment that's negative, or that there's something wrong with their skills or abilities, that's going to increase the likelihood that they have difficulties feeling good about themselves, and also make them a little bit anxious about performing. And those with mental illness have increased risk for poor school performance. So the two kind of go hand in hand. When fear and worry persist, it can become anxiety, and anxiety usually precedes recurrent abdominal pain. So that isn't necessarily always the case, but it can. So if your child's constantly complaining of stomach aches, anxiety could be a precursor or something that leads to the development of that. So additional signs. So this is taken from the DSM, or the Psychiatrist Bible. So some symptoms to consider: anxiety is connected to sleep problems. So across a lot of childhood mental illness, what you see is difficulty with sleep. You might also see clinging behavior, or the child not being able to sleep alone. And that doesn't, again, mean like sometimes parents do sleep with their kids at certain ages, and it varies culturally. But if it's not something that's typical for your family and you're seeing a change in behavior, that's when really you should be concerned. Fear of the child is fearful of being alone. Excessive distress when away from home or from being caregiver. So a child reporting, no, I don't want to go to camp, because I'm afraid of being away from mom and dad. Or if a mom or dad goes out to run an errand, constantly checking in and texting and being like, where are you? Where are you? Increased worry. Like I said before, going to the parent's bed during the night, nightmares. Adolescents may experience heart palpitations related to anxiety, or feeling faint, because of the rush of adrenaline that accompanies anxiety. The child might feel kind of faint. Additional signs to be concerned about at school: some things not turning in homework. And that's tricky too, because that could be indicative of forgetfulness, but it could also be indicative that the child's afraid of being evaluated, and so that's something to consider. Constant reassurance seeking from the teacher, so constantly asking, is my work okay? Or spending excessive amounts of time around the teacher, kind of just seeking general reassurance, in spite of the teacher being like, yeah, no, everything's okay. Avoiding socializing or group work, so opportunities that are present at school, such as recess, the child, instead of going out to recess, prefers to stay inside. Disruptive behavior can also be indicative of anxiety, so a child who has difficulty remaining seated and decides to leave the classroom, and it seems to coincide with any time that that child's being evaluated, or they're having mild social concerns or interaction difficulties with peers. Irritability, just like with depression, irritable mood in children can also be indicative, possibly, of anxiety. Crying, of course, can also be indicative of anxiety. Frequent trips to the nurse or bathroom at school, and again, when physical illness has been ruled out by a medical practitioner, if that's occurring, that can be indicative of anxiety. And then, as I mentioned before, somatic complaints without a basis. So what can a school do? So some schools have a progressive approach in terms of mental health screening. And in this particular study, they found in this school district near Philadelphia that Some schools were screening, they had implemented an approach with nurses where they screened all students. Um, while they were doing the physical screening, they also gave the mental health screening to all students. And in terms of the measures that they use publicly available measures, the first of which is the Patient Health Questionnaire 9 and the 5-item screen for child anxiety-related disorders. And this was done with a group of middle high school students. So then those students who met cutoff criteria, who endorsed on these screeners as more items than usual, those students were then referred to student assistance teams. And then school nurses reported after the study that the addition of those tools opened a channel to talk with students and parents in a deeper, more personal way. So it doesn't necessarily have to be nurses who conduct the screening, but it is just helpful to think, what are things moving forward that school districts can consider in terms of targeting kids earlier when they're first beginning to develop anxiety symptoms. So these are just some items from that screener that were given to the, and these items clearly are more appropriate for late elementary, middle school, and high school students. So children, ages like 8 onward. So some items are getting frightened for no reason at all, being afraid to be alone in the house, people telling me I worry too much, being scared to go to school, or endorsing that they're shy. So when like 3 or more of these were endorsed, that those students would then be referred to a student assistance team. So thinking about the relationship between anxiety and different kinds of disability. So in terms of generalized anxiety disorder, and that's kind of like when the child doesn't have a specific phobia, like they're not afraid of, animals, for example, or they're not afraid of they don't have social anxiety, but they're just, it's a more pervasive kind of fearfulness. That's linked to worse performance than adults with generalized anxiety disorder. And kids with anxiety tend to worry. It makes sense because they spend most of their time at school. They tend to be more concerned with their school performance than adults with generalized anxiety disorder. So some theories about the relationship between learning disability and anxiety. There are various theories that it could be a secondary reaction, something that develops after a learning disability. It could be the primary disorder, or it could be, a cause of some kind of cerebral dysfunction. Others believe that anxiety develops as a result of learning difficulties compared to learning problems developed are caused by high levels of anxiety. And these co-occur based on brain-based etiology. So it's beyond the scope of this presentation, but sometimes some of learning disability and anxiety might share an underlying neurological basis in common. Academia, clearly, as we talked about earlier, autonomy, children developing autonomy and self-worth is an important part of their development, and increased pressure to achieve can contribute to the development of anxiety. So it's important that schools and parents manage expectations for their children appropriately. So in terms of anxiety and reading disability, this particular study found that nonverbal learning disability and reading disability were associated with more anxious symptoms for children compared to typically developing children or children without a nonverbal learning disability or reading disability. High levels of generalized anxiety might be due to the perception that things are beyond their control, regarding that autonomy and self-efficacy that we talked about earlier. High levels of social anxiety and nonverbal learning disability may also be due to difficulties with social cognition, being able to recognize emotional states in others. If you can't recognize the emotional states in others, then you don't necessarily know how to approach them. You might be getting negative feedback from your environment, and that can lead to development of anxiety. Preventative approaches should be focused on sensitizing teachers and parents to their children's distress. So that study that we talked about earlier, about providing general mental health screening for all students as part of a routine nurse physical checkup, that's one approach. But it is important that the students in general are targeted. The authors of the study indicated that some older literature supports that emotional needs for children with learning disability are often underestimated and frequently ignored by teachers because of overwhelming focus on learning disabilities. So that kind of makes sense. If a child is having a lot of concerns with academics, it might be easier to miss some signs of anxiety or other mental health difficulties. So anxiety and autism spectrum disorder. there is quite a bit of link between the two. In fact, there's substantial symptom overlap between anxiety and autism spectrum disorder. But, for example, obsessive compulsive disorder results in repetitive or compulsive behaviors. So that's just one example that, they share some kind of overlap. Or, by definition, with autism spectrum disorder, a child may choose to withdraw from peers, and that can overlap with symptoms of, social anxiety. So this particular study found that additional diagnoses of specific phobia, obsessive compulsive disorder, and social anxiety disorder were found in approximately 40% of children and adolescents with autism spectrum disorder in one meta-analysis. So a meta-analysis is just a summary of a lot of previous research studies. So they found that pretty much almost 1 out of 2 kids with autism spectrum disorder met criteria for a co-occurring anxiety disorder. So it's important to note that third-party graders, that is parents, teachers, are really important to identify additional anxiety symptoms as children. Given that children and adolescents with autism spectrum disorder may lack insight into their emotional state, they may not be able to verbalize that they're feeling anxious, or they may confuse being angry or feeling anxious. So it's really important that, for children with an autism spectrum disorder, that parents and teachers work in partnership and are vigilant to make sure that the child, if the child's exhibiting anxiety, that it's treated. So some general tips for parents: be calm. Clearly, that's easier said than done. But we model as parents model for their children behaviors. So how a parent manages anxiety, his or her own anxiety, relates a lot to how kids learn to manage their own anxiety. So, for example, if as a parent you tend to avoid conflict, or have difficulties being assertive, or if when you get anxious you get really mad, it just might be helpful to just, no one's perfect, but just try to be more cognizant of how you manage your own anxiety, and try to figure out healthy ways to cope with it. It's important to listen and support children, clearly, check in with them daily. How did school go today? And try to see if there are any changes from what is typical for your child. Modify expectations. So we talked a little bit about academic expectations. Sometimes those expectations may not be appropriate for a particular child, or, and it's important that you're aware of what your child can do, and not push them excessively. It's important to not just tell your child to be brave. So when you say, like, don't be afraid, be brave, that can come across as really invalidating of a child's, emotional state. It's important to kind of just work with the child and his environment or her environment to address that anxiety. Prepare for transitions, particularly for children with autism spectrum disorder. It's good to give a child, just in general, a heads up that something might be changing in the routine, or that they might be going to the doctor to get some routine shots. It's important to recognize a child's accomplishments, and recognize all the things that they're doing well. As we talked about, children between the ages of 7 and 12, they're really working on developing a sense of autonomy and a sense of feeling good about their own accomplishments. So it's important to praise what you can. Advocate for your child. Clearly, like, if you think something is amiss at school, reach out to your child's school, request an appointment with the school counselor, or someone from administration. So that's just one possibility. Help children learn triggers and skills to cope. So if your child's fearful of going for routine exams at the doctor, you can practice things like, Fivefinger breathing or deep breathing. You can, say, tell your child to say positive self statements. And it's important to practice good sleep hygiene and healthy diet. So when a child develops anxiety or depression, one of the first areas of concern that typically develops is sleep hygiene, that the child's not sleeping enough, or sleeping too much, or is waking up in the night. So sleep is a good proxy for child mental health difficulties. So these are some additional resources for parents. The first of which is from the Anxiety and Depression Association of America. This particular website has a treasure trove of a lot of different podcasts or webinars that you can access, as well as just general articles. And it really has an abundance of information. So Substance Abuse and Mental Health Services Administration, SAMHSA.gov, that's a good website, particularly if you're considering looking for a treatment provider. You can find out which treatments are evidence-based through that website. And then, based on that, find out which providers provide those treatments. And then WorryWise Kids is another good resource that gives parents some information regarding child anxiety. So these were the references for the presentation. And I'll take questions. And I just wanted to thank Jennifer Spillman, who's a predoctoral intern at Grace Psychological Services, for her assistance in the literature review of this presentation.
Awesome. Hang on, let me get Megan on. I've got to unmute her. Well, it helps if I unmute the right person.
There you go.
There you go.
That's complete control of my microphone. So there you go. All right, so we are going to start taking questions. I see that we already have some pouring in the Q&A box. As a reminder, the chat box can get really overwhelming. So if you guys don't mind, put your questions for Dr. Hallmark over in the Q&A box, and you'll be able to find that either on the bottom or the top of your screen in the menu bar. So are you ready to start taking questions, Dr. Hallmark?
Absolutely.
All right, so our first one, how does anxiety impact a child's ability to do self-care, such as bathing, dressing, and toileting? Especially interested in 10 to 12-year-olds because there's an increase in requests for attendant care. If parents can't get the child to participate in a task, how would untrained attendants be helpful?
So in terms of a child who's not engaging in self-care or being able to carry out activities of daily living, whether it's a 10 to 12-year-old or someone younger, it's important to provide opportunities where the child can do those activities independently. So like if they're not bathing themselves or if they're not dressing themselves, you can always start with like what's called successive approximations towards something. So try to take that task, something like bathing yourself, and start small. Start by doing it putting it into discrete steps. So that first thing you might have the child do is like go and open, the shower curtain, or turn the shower on, and then kind of reward that child for doing whatever it is that is indicative of self-care. That's one thing that you can do as a parent.
All right. What age should a child be completely comfortable sleeping alone in their own bed?
Okay. So typically for like a 2-year-old or a 3-year-old, those children should be able to sleep in their own bed. But that varies, of course, by culture. Some parents have different, expectations. But I know that, it's around that age that we start becoming concerned if a child's not able to sleep in their own bed.
All right. What are the major differences between an anxiety and a panic attack?
So a panic attack can be a discrete episode, or it can be its own disorder. But for panic attacks might include things like heart palpitations, a feeling of derealization, like you're not in your own body. You feel like you're going to have a heart attack. You might have a sensation that you think you're dying. And those are more associated with a panic attack itself. Whereas general anxiety, it includes some things like, heart palpitations, or it might include like, negative, thought patterns, but it's not exactly like a panic disorder. A panic disorder, I think, and as a discrete episode, it tends to be more severe.
All right. Can you explain Fivefinger breathing?
Oh, okay. Yeah. So this is something I learned from another psychologist in the department, and there are lots of variations with this. So one thing, like you might have a child do is like, um, uh, blow out a candle on a cupcake, smell a rose and blow out a candle. So I'm pretending I'm smelling a rose, blowing out a candle. You want to get some kind of visual representation. So five finger breathing, really all you have to do is start here and you're 1, 2, 3, 4, 5. So that's just a rundown of it. It's very simple, and it's something a child can do discreetly. Like they can just do it. And I've seen it work for like using it, particularly elementary school children.
Okay, and then we had a question come through on the chat box. How would the parent request additional help with their child's school? Would they just request an ARD meeting?
Oh, wow. Okay. So it depends on what the particular difficulties are. So in terms of requesting an ARD meeting is something that you would request if the child's already receiving special education services. So if that is the case, a parent can always request an ARD for their child. But if it is just a general education student needing additional help, it's appropriate to reach out probably to your child's assistant principal or the school guidance counselor, particularly if it's related to concerns involving anxiety.
All right. Given the overlap with autism and anxiety, would it be helpful to diagnose a child with both disorders, or is there a time it would be helpful?
Absolutely. So I do work a lot with kids who have co-occurring autism spectrum disorder and anxiety. And I think, the purpose of these diagnoses is supposed to be a shorthand so that people can communicate with each other and coordinate services and coordinate treatment. So in terms of generalized anxiety disorder, that indicates that a child is fearful, has a pervasive fear of things in general. And that is helpful for someone to know so that they can work through those difficulties. Because not every child with an autism spectrum disorder necessarily manifests inordinate amounts of anxiety.
All right. We have my child's anxiety is at its highest since we had the shooting in our city. He will not go to the store. He would rather stay with someone else while she runs errands. Are there any tips or suggestions on this or situations like this other than going to the counselor?
It's really unfortunate that, now with the climate and the way that things are, that a lot of adults and children are reporting being fearful in public spaces. I don't remember exactly, but I remember reading recently that maybe like a third of Americans are reporting that they're fearful of being in public spaces. In terms of what you can do with helping your child on your own, you want to encourage exposure. You want to encourage that, first provide education, say like, okay, you know how likely something is, well, it's not very likely that this is going to happen, and explain that likelihood to the child. And also encourage them to go with you and go into those public spaces. So the National Association of School Psychologists, I know, has some helpful handouts for parents regarding children's increased anxiety in the wake of these shootings. That might also be helpful to look at. So that website, I believe, is nasp.org, and I can also send those handouts after this presentation to you. Okay.
Excellent. Thank you. All right. What is the best way to talk to your child about concerns about their anxiety?
Okay. So it's important to just use, basic language, and say to your child, like, hey, I've been noticing that sometimes you're fearful of doing this particular thing, or I've been noticing that you're not hanging out with your friends as much. But pretty much set the stage so it's an open and honest conversation. Try not to, your child may be defensive if you say, like, I think you have an anxiety disorder. That's clearly not the way to go. You just want to be gentle and kind and try to talk to your kid the way you would want someone to talk to you. Like, use simple language, Be clear, be like, these are some of the concerns I have, and it's okay that you're having these concerns. And try to keep an open and honest channel of communication.
All right. Do you find that a child can overcome anxiety, or is it just something that they must feel?
So that's an excellent question. Anxiety is totally treatable, and a lot of children and adults with anxiety overcome it, every day. And how does that happen? Overcoming anxiety really is a lot about changing the way that you think, adjusting the way that you think, and it's also about exposure. So exposing yourself to those things that are making you fearful. And that doesn't necessarily have to happen with a mental health professional. A parent on their own can encourage exposure to things that's making the child fearful in small ways. But that's absolutely something that a child, parent, adult can overcome.
Okay. Any advice for decreasing social anxiety for an 11-year-old with autism spectrum disorder? He repeatedly asks classmates if they are his friends and does not seem to listen to answers. He just keeps asking the same things over and over.
So there are a lot of different approaches that you might take. One approach you can take is kind of a social story to encourage appropriate social behavior and explain, that if a child's having difficulties, and constantly seeking out feedback, from other kids, that might kind of push people away, and putting a limit on the number of times that child can ask their peers if they're his friend. That's one thing. Another thing, like I was saying before, is exposure. So if they're exhibiting social anxiety and they're fearful about interacting with other kids in general, try to set up kind of like a hierarchy of behaviors and start small. So like maybe the first thing is saying like hello to another kid, or even just looking at another kid when in public. The second thing might be like making an invitation to another kid to play. The third thing might be, going to a birthday party. And that'll look very different depending on the particular child, but that would be, an approach is slowly and gently exposing them to increasing levels of things that are making them anxious in social situations.
All right. You mentioned 1 in 5 have a mental disorder or learning disability. How do you define mental disorders? Learning disabilities or neurological disorders? Do you consider this in the same category as mental disorders?
Absolutely not. No, it's not that they're in the same category. And it's just about understanding that, 1 out of 5 or 20% need extra assistance or need targeted interventions to deal with those difficulties. But I would not classify a mental health illness as the same thing as a learning disability. There may be overlap where they may co-occur just because, for example, if you're having difficulties learning and you're getting feedback from your environment, like we talked about before, that you're not good because you're having those difficulties, that can lead to development of anxiety, but they are separate categories.
All right. Can you recommend a curriculum or program that would be helpful for a child with anxiety that has difficulty reading?
Okay. So in terms of school-wide anxiety programs, I'm not completely proficient in those. I can, I definitely have access to some general curriculum programs that might be appropriate, social emotional learning programs that are school-wide. In terms of working with an individual child, one program that I use is Coping Cat, and that's an evidence-based treatment for anxiety. And basically it's broken down into the first part we teach coping skills, and the second part is based on exposure. So what that might look like if a child has a reading disability, that might be like reading aloud to me in the session and then practicing reading aloud to somebody that he or she wasn't comfortable doing that in front of before. So I feel like I don't have a ton of information to answer your question completely, but those would just be some starting points.
All right. If your child has dyslexia, should the school start looking at some sort of anxiety disorder, being that learning disabilities are linked to anxiety disorders? She sees families in her support group for children with dyslexia. Their children are starting to freak out and don't want to go to school now that school is starting back. The children are telling them they are depressed or scared to go back to school.
Okay. So if a child is reporting that they're fearful of going to school and that's clearly interfering with their ability to be at school and it's affecting their academic performance, then an evaluation might not be necessary. You might just need a general consultation where there might be things that you can do in terms of accommodations or modifications for a child identified with dyslexia rather than having to go the evaluation route. But if those concerns persist, then you should consider, looking at an additional eligibility that might be emotional disturbance, and based on a particular anxiety disorder. But I just emphasize, not every child with dyslexia needs to be evaluated for an anxiety disorder. A lot of children, are able to manage having a reading disability just fine. But if you are seeing additional signs and concerns like the ones you're reporting, that they're fearful of going to school, or they're feeling sad or depressed, then that's definitely something you should investigate further.
Okay, is there an age at which beginning medication is more appropriate than others?
So I'm not a licensed physician, so it's outside of my scope of practice to prescribe medication. But I can talk generally about medication. And I can say that medication for children has been helpful. I've seen kids as young as preschool receive medication. I can say it varies on a case-by-case basis based on level of impairment. I can say there's a lot of research studies that show that there are negative side effects to children receiving medication. Some of those side effects might include increased suicidality or suicidal ideation. I can also say that there is research to support that cognitive behavioral treatments can be as effective as receiving medication, or even better in some instances. But of course, it's important not to make a blanket statement about children in general, but rather take an individualized approach of what's appropriate for that child. But that's definitely, I would bring a general medical provider's attention, a pediatrician.
All right. When or if is an evaluation by a neurologist recommended for a child on autism spectrum disorder with generalized anxiety? Is there a benefit or additional insight the specialist could provide?
I think it goes back to the level of impairment question. You don't want to expose a child unnecessarily to an evaluation process. There's aspects of it that are not enjoyable. It can be a little bit of intrusive. It is kind of in itself an intervention. So in terms of a neurological exam, it is, if you're seeing things that are indicating a very high level of impairment, if a history of seizures or severe developmental delays, that's probably something that you want to check out further. In terms of a generalized anxiety disorder, that's something you can have evaluated by a licensed psychologist or a psychiatrist. It doesn't necessarily have to be a neurologist.
Okay, my 8-year-old and 6-year-old are resistant to therapy, but both show signs of anxiety. They prefer to avoid the topic that is causing it and get upset when it's brought up. Should I insist on treatment or just leave the door open for when they want to talk?
I think it's important to try to find a treatment provider that's a good fit for your kids. And it's completely normal that if they don't want to talk about something, they get upset when it's brought up. That's kind of goes hand in hand with some types of anxiety. So it's important to find a treatment provider that can address your child's specific needs and make it seem maybe less like therapy in the traditional sense and something more like interactive or collaborative, so that your child can overcome some of those fears and feel comfortable expressing them.
I work with children ages 2 months to 5 years old. Do you have any recommendations or information for this age group?
In terms of anxiety disorders, I guess for that age group, what I often see, what comes to me in my work is children who are identified with some kind of functional language impairment, who are having difficulties speaking and might become anxious because of that. something I see at that age that's concerning is selective mutism, for example. Other things that come up with that age group is separation anxiety. So for each of those, there are different recommendations that go hand in hand with each of those. But I would definitely recommend that if you want more information regarding that, to check out one of those links towards the end of the presentation.
Great. If a child or any person is doing psychological therapy for anxiety or any other disorder, would you recommend complementing it with neurofeedback?
Okay. So I know about neurofeedback in the general sense. And I don't want to, I'm not trained in neurofeedback, so I don't want to speak to that particular intervention. But I can say that in my experience, I have seen parents implement, go for psychological therapy, have their child in psychological therapy and receive neurofeedback concurrently. Neurofeedback really is about recognizing somatic cues and being able to regulate those consciously. So I don't see that the two would contradict each other.
All right. What can you do when a 14-year-old keeps on coming down in the middle of the night and getting in bed with you? Single mom, child has ADHD and social anxiety.
Okay. So it's important to be kind of, warm and genuine, and to not, some of those tips, have an open conversation with your child, like, hey, this is concerning me, it would be better for you to stay in your own bed at night. You might consider a reward system, like what's for a 14-year-old adolescent, some rewards, like maybe that might be a video game, or maybe that might be a social reward, like getting to go to a place with the parent. But you kind of just want to try to get your kid to not come to the bedroom with you. So one thing you can do is kind of try, like, on a night by night basis, depending on how severe it is. Like, start with one night, and like if they're able to do that, reinforce that, and then go to 2 nights.
Okay. We are seeing an increase in anxiety disorder scripts calling for homebound services. In some cases, the news stories of shootings and such cause increased anxiety in all individuals. How do you differentiate between normal news-based anxiety and something more?
Okay. So it goes back to frequency, duration, and impairment. So if on the basis of that anxiety is interfering with tasks of daily living, like they refuse to go to school, and it appears to be linked to anxiety rather than just being oppositional and enjoying being at home more, that's definitely something that you should look into further and consider an evaluation for. I know for homebound services, that's not something that I handle in my school district, but I can say that that's a common request, that for kids who are anxious about going to school. It's typically, homebound is reserved for children with kind of severe physical impairments. But so I haven't had that much exposure to kids on the basis of anxiety receiving homebound services.
Could anxiety delay speech in a toddler?
So in terms of in terms of being fearful in general, I would say it is possible that anxiety can interfere with speech development, even as young as toddlerhood. But it's important to look for other cues, not just refusal to speak, but you also want to see if they're fearful in general or showing other signs that they're excessively worried.
Okay. What are some suggestions for techniques to use for a 10-year-old that is sleeping with his mom every night and cannot go to sleep without rubbing her back every night? If he does get this experience, if he does not get this experience, he has a difficult day the following day.
Okay. So in terms of that situation, it's kind of, my suggestion would be the same as the parent before. Try something on your own in terms of rewarding your child for being able to, do these things on their own, and try to lengthen the amount of exposure while rewarding them. I think it might also be appropriate if you're able to consult like a psychologist or a counselor, to conduct an intake to see what additional suggestions they can offer.
Okay. How do you differentiate between nightmares and night terrors, and how do you respond?
Okay. Nightmares, just a garden variety nightmare is something that, most of us experience at some point or another. And night terror, however, is usually accompanied by, screaming, or it's something, the person having a night terror might wake up drenched in sweat. So really for night terrors, it's about level of severity. Night terror is more severe than a nightmare.
Okay. In recent years, bullying has been a major problem and topic at most grade levels. Does being bullied lead to other mental health problems other than an anxiety disorder?
Very much so. So in terms of being bullied, they've found research that, a specific subset of children who are bullies had previously been bullied. And for sure, that can lead to lots of other different kinds of outcomes. Children who are bullied are also at increased risk of depression. They're also at increased risk for oppositional defiant disorder or disruptive behavioral disorders. So yes, there's a lot of unfortunate and deleterious outcomes that come as a result of being bullied. And it's beyond the scope of this presentation, but being bullied is a very specific thing, both in literature and both with schools. Being bullied really means there's a power differential, between who's being the person who's the bully and the person who's being bullied. It also is perceived as being bullied by the victim. So those are just some specific things, and it's something that's repetitive. It's not really a one-time thing. So those are just some things to keep in mind.
Okay, so we're going to get one more question knocked out before we have to wrap the recording. I know that there's just tons and tons of questions coming in, and Dr. Hallmark, I don't know if you want to stay on after we wrap the recording to answer some more of these, or if you want me to send these to you and us follow up in like email form. It's whatever you would like to do.
So unfortunately, I have another appointment after this, so
Sure.
I would love to follow up via email. That would be great.
Okay, perfect. So just one more question and then we'll get going. Can you provide some techniques that we can use to help a child that has fear of separation from a parent? What can a parent do or say when the child needs to perform an activity by themselves?
So something you can do is emotional coaching. You can say, like, you can reinforce and praise liberally your child for being able to do specific things on their own. And you can start small. You don't have to for separation anxiety. You can start by just being on the other side of the door for a specific amount of time. And then, when your child's able to do that, without becoming distressed, reinforcing that, and then moving from there and kind of lengthening the amount of separation. I think the important thing with separation anxiety is that there's a tendency for parents to want to see that if their child's becoming distressed, that's something bad. So I think that's one thing to look out for, that if your child is a little bit distressed by being separate and you go and reach out to them, to kind of calm that distress, that just tends to reinforce the anxiety. So to the extent that your child is distressed but isn't hurting themselves or hurting anyone else or isn't severely damaging property, it's important to kind of be okay with your child being exposed to that distress.
All right. Well, let's go ahead and get some information done so that we can wrap the recording. So a few things to put on your calendars. We have some really cool upcoming webinars. So Tuesday, September 17th, again at 12:15 Central Time, we're going to do behavior intervention plans. And that's in collaboration with the Region 10 ESC and SPED Tech. So they'll be talking about behavior intervention plans and all of the ins and outs of those. On Tuesday, October 8th, you can join us with Colleen Elby from Disability Rights Texas, as she talks about bullying laws involving students with disabilities. And then Tuesday, October 15th, we'll be joined by Richard Capadagli, as he talks about helping kids cope with bullying. So I know there were some questions in this presentation about bullying, so make sure you join us October 15th to get some additional information about that. Coming up, we also have October 22nd, conflict resolution with Cadre. And this is the Center for Appropriate Dispute Resolution in Special Education. And our special guest speaker is Melanie Reese. She's going to talk about all of the different conflict resolution options that parents have and be willing to answer questions on that. We do also in October have Dr. Hallmark coming back to present on bullying and what to do if you feel like your child may be the bully. He's actually going to present on that in Spanish. So if you know anyone who needs a Spanish presentation, Dr. Hallmark will be joining us in October, and that date will be announced on our website as soon as we get everything set up. And coming up in November, we're going to do transition services in the IEP. That's going to be with David Bianchi, who is the Director of Advocacy for Circle and Associates. All right, we also have a Facebook Live series happening now. And if you missed the first one, it was Thursday, but you can join us for the next 3 weeks, starting Thursday of this week, August 29th, talking gearing up for the new school year. And the topics are who do you call, amending the IEP, and then what do we do if the IEP is not working. So make plans to join me for those, as well as a Spanish presentation immediately following mine. All right, here is our information. If you had questions that were not answered today, specifically anonymous posters, if you will email those to me, to my email address, we'll get those over to Dr. Hallmark and we'll get you some answers to those questions. You also have Christina's email information as well, and then our website and our Facebook page. Thank you, Dr. Hallmark, for joining us. We know you got to go, but we really do appreciate you jumping on and sharing this amazing information. We look forward to October to see you again.
Everyone for your time joining the presentation. Have a wonderful day.
You too. Thank you, Dr. Hallmark.